Today, we take a look at the country's efforts in overcoming cancer.
So, when we talk about cancer care in Nigeria, the conversation always comes back to capacity. And the reality is very simple, but very unsettling as well. For a population of more than 220 million people and counting, yet the infrastructure to fight cancer is still painfully limited.
And thousands of patients embark on long, exhausting journeys just to reach treatment centers. I mean, I've known quite a few myself, and waiting lists stretch for months. And for many, catching the disease early is simply not an option.
Tragically, cancer claims around 80,000 lives in Nigeria every year. And the most common types include breast, cervical cancer, as well as prostate cancer, affecting thousands of families across the country.
You're right, Clara, and reports still show Nigeria actually needs more than 100 radiotherapy machines, but the country only has a fraction of that. Some reports mention 15.
Actually, World Health Organization, recommend 300 of those machines.
And we're talking 15.
And we're talking about 15. It's not even 15, but we will get to know the exact figures. But most radiotherapy machines, those of them that are available, are concentrated in a handful of major cities, leaving millions without reasonable access. Even where treatment exists, cost, of course, becomes another barrier.
Now, public hospitals face equipment breakdowns and maintenance challenges, while private centers, though more reliable, charge fees that most families simply cannot afford. And on top of that, cultural beliefs and stigma often delay people from seeking treatment, which can make survival even harder.
Absolutely, but it's not all bleak. We don't want to, frighten anyone. There is hope in the horizon. We have new oncology centers springing up. Training programs are also expanding, and public-private partnerships are also slowly building the framework for better cancer care.
Now, the challenge is turning those efforts into real access for real people. So progress isn't just numbers on a report, but something that patients across Nigeria can actually, see and feel. That's exactly what we'll explore today on Good Morning Nigeria as World Cancer Day is marked. Thank you for joining us. I am Victor Azu.
Indeed, and I'm Claire Adilabu Abdul Razak.
Cancer is a growing concern in Nigeria, with an estimated 127,000 new cases diagnosed each year. As such, experts insist that overcoming cancer in Nigeria requires a multifaceted approach that involves government agencies, healthcare professionals, and individuals. Nigeria's cancer program and plan through the Federal Ministry of Health since the year 2018 till date reported that cancer is responsible for 80,000 deaths in Nigeria every year. According to medical experts, the most common types of cancer in Nigeria include breast, cervical, and prostate cancer. And the questions many ask is why cancer is claiming so many lives in Nigeria. The country's health record indicates limited access to healthcare services, lack of awareness about cancer prevention and early detection, cultural belief, which may lead to late diagnosis, inadequate screening program, and challenges in assessing proper treatment and care are the major reasons for the figures. In addition to lifestyle modification to reduce cancer risks and improve access to affordable and quality healthcare services, experts believe early detection, timely treatment, and vaccination are key in improving outcome for cancer patients. The National Institute for Cancer Research and Treatment is expanding access to the Cancer Health Fund, with Nigeria inaugurating several oncology centers aimed at improving cancer care. What are the challenges facing cancer care in Nigeria? How can awareness and education programs be effectively implemented to promote cancer prevention and early detection? What role can public-private partnership play in improving cancer care in Nigeria? These and more will set tune for our discussion on Good Morning Nigeria, as our guests are ready for the conversation on overcoming cancer in Nigeria.
All right, many thanks, Ibrahim Bello Gunda, for that background report. Now, let's begin this conversation by bringing in our guests, and I begin with Professor Usman Malami Aliyu, who is the Director General and CEO of the National Institute for Cancer Research and Treatment. A pleasure to welcome you to Good Morning Nigeria.
Good morning. Thank you for having me this morning.
All right, let me also welcome Dr. Emmanuel Ikile, who is consultant, radiation, and clinical oncologist. He's also head of department of the Radiation and Oncology Department at the University of Benin Teaching Hospital. And thank you very much for joining us.
Good morning. Thank you for having me.
Claire.
All right, we also have, with all pleasure, Chioma Ikejani. Chioma Ikejani is a stage 4 cancer survivor. She's also a strategic media consultant, Amoy Productions. Chioma, it's a pleasure to have you. Thank you for coming to share your experiences.
Thank you.
All right, we also have Dr. Omolola Salako, consultant, radiation and clinical oncologist, Lagos University Teaching Hospital, and he's joining us via Zoom from Lagos. Dr. Salako, thank you very much for joining us. If we can see you. All right, Dr. Salako, thank you for joining us. Hello, Dr. Salako, can you hear us?
Yes, thank you.
All right, thank you very much. All right, thank you very much. We needed to know that your audio is fine. So let's come back to the studio, and I mean, I just like to background our conversation this morning by having, okay, I understand that our guest in Ibadan is also there. That's Dr. Jimo Mutiu Alani. Dr. Alani is a radiation clinical oncologist. He's also head of department, nuclear medicine, University College Hospital, Ibadan. Thank you very much, Doctor, for joining us for this conversation. All right, thank you very much. I hope your audio is fine. We'll come back to that. But again, Chioma, like I said, it's a pleasure to have you come share your experiences with us. And I just wanted to start, in a way that touches, is of great concern. We understand that over 70% of cancer patients in Nigeria present at advanced stages 3 and 4.
That's exactly.
And that is where the treatment becomes very, very complex and dangerous. But you presented at stage 4.
Yeah, that's exactly what happened to me.
So how many visits to the hospital did you make before you got correct diagnosis?
I only went to one visit, and it wasn't even about breast cancer, because even though I felt the lump, I didn't do anything about it. That's why it's called the silent treatment.
You felt the lump?
I felt the lump for about a year. I didn't do anything because it didn't affect me. So I just went for a physical examination. And so the lady said, oh, there's a lump there. I said, yeah, it's been there for a while. She said, oh my goodness, we have to take you and do a mammogram. So that was when my life changed. So the mammogram discovered a lump that was 13 centimeters. It was big. And so they whisked me up to do a biopsy. Now the first biopsy was clear. But here's the trick. I had a laser smart oncologist who said, are you feeling pain right here? And I said, yeah. But because I was in my early 50s, I thought, oh, maybe it's menopause. He said, no, maybe it's your, it's something is wrong. So we went in again, and he said, I'm going to do the biopsy myself. So I went in the second time. So that's the key, persistence and doing that second biopsy, second opinion, because it could be clear, but if there's something wrong, you have to check it out. Now, can you imagine if I only did that first biopsy? I would not.
When you say clear, what does that mean?
Clear means that it was positive, it was benign, there wasn't anything there. So they would have taken it out, but I would not have done chemotherapy. So I definitely will not be sitting here 10 years later. So it's really important to advocate for that second opinion. If something is wrong, even if you see the medical report that says it's benign, there's nothing wrong, but you still have symptoms, right? You have to investigate and you have to do the right thing. And thank God I listened to the doctor, because some of us are so scared that we hang on to that diagnosis. No, I'm not going to do anything. But I listened to my doctor, and that was what saved my life, because the second report came out HER2 positive, which is the most aggressive cancer, and I was stage 4.
Yes, you're stage 4, and this is your 10th year.
This is my 10th year
of surviving, and we understand that only 25.6% of cancer patients survive beyond 5 years. So what has your journey been, and what made the difference?
In Nigeria. And I know
really?
people are going to laugh. Yes, the difference actually was I was in Nigeria at the right time. I think my lifestyle in Nigeria played an amazing part, because the food is incredible. So I completely changed my diet. First of all, I listened to my doctors. The food, I became a vegan and I ate vegetables. We have the best shower shops in the world. We have the best fruits, vegetables. So organic. I mean, it would cost me an arm and a leg if I had to do this abroad, because it's that expensive. In Nigeria, I can go to the market and negotiate, right? So discipline. And then the weather, I was able to walk and exercise. So I think Nigeria saved my life. And quite frankly, and I have to say this, the political will of the government, I was here at the right time where they decided that cancer must be something that we really look into. So we have programs, and I know he's going to talk about it. There were programs that I became involved in and that saved my life, Cancer Health Fund, NHIA. There are many programs that give you the ability to live your life without breaking your pocket. It's just that you have to be intentional and find out what those programs are. So that's really what has kept me going. And I do every 21 days, I take a chemotherapy medicine. It's called Herceptin and Projecta. So I have to take that so that the tumors don't appear. So I have never missed it in 10 years. And there have been a lot of people that have assisted me, like Medicaid. Medicaid has been very instrumental, because 5 years ago, the cost was a little bit more, but Zainab Shinkafi Bagudu made it possible for me to get my drugs at a really low cost because of the program she had at Medicaid. So there were people that were there that really assisted me, and the government was there, and Nigeria was there. So I'm a big advocate.
All right. Thank you very much, Joma. I can relate a bit, and I say this because my mom is also a cancer survivor. I was much younger then. I think I've said this here before. She's almost 80 now. She should be 80 next year. And this was in 1996.
Wow.
So, and clean, she's lived her life. She's almost 80, like I say, she's alive, hale and hearty. So I can relate. And then, how much did it cost again? I think about 50,000 naira, if I remember clearly. Then it was also big money. But thank you for sharing this experience with us. But let me get to Professor Aliyu.
Sorry, Victor. Before you now bring in the professor, I still want to draw something from Chioma. Because you talked about, just for a few days ago, my husband's family lost a young lady in her 40s because she had breast cancer. But I remember you talking about different types of breast cancer.
Yeah, they are. Are you double negative? Are you double positive? Are you positive with protein estrogen. So there are many types of cancer. Cancer is there's not just one type of cancer. So there's a lot of medicine, and he can probably, the expert here can talk about it. I was HER2 positive, which means that I produced too much estrogen. And that was what was creating the tumors. So it was very targeted. The good news, actually, is that there's so much research in cancer right now that there are different kind of targeted therapy drugs that really hits at the cell. In the olden days, they would give you chemotherapy forever, and that really destroyed the body. They don't do that anymore. It's very precise, and there's many machines, and people are going to be stunned. Nigeria actually has centers that are exceptional, and they have amazing machines. So yes, can we fight cancer right here, right now in Nigeria? Absolutely, 100%. And it really doesn't matter what kind of cancer you have. Nigeria is ready to fight cancer. And we don't have to do medical tourism.
All right, we will get to that. Victor, please go ahead.
With
yes. Thank you.
Now, Prof,
Yep.
let's get to the basics. I know it's a question, people get to ask and answer every other day. But what is cancer? How does it develop? What are the variants?
All right, so thank you very much for the question. It has always been the question that we specialists in oncology have been asked, regardless of where you are, whether on the media or in the street. So generally, when we say cancer, cancer can be defined as like a kind of a group of diseases that is characterized by rapid and uncontrolled division of normal cells within the body. Virtually the growth of cells that form the tissue within the body, the organs, and then form the system within the human being are continuously growing because of the wear and tears of the activities we do nowadays. This division is controlled by certain signals from the body. Now, it's a cascade of activities that scientists call homeostasis. So like the blood cells, if you look at them, they are being replaced and changed every 120 days, the red blood cells. So likewise, if you are constantly doing some activities, sometimes you do notice that your palm is peeling. So that is all part of the activities that is constantly going on within the body to replace the worn out old cells within the body. So there is a system that controls that. But in the case of cancer, the body or the cells lose that ability to control the cell division that is being carried out within the cells. So now the cells are going haywire. It has the ability to grow, to divide, replicate uncontrollably, and it will start, depending on the area where the problem starts, it will start impinging, putting pressure on the surrounding cells and structures within the body. And now you start seeing the swelling, the mass that we are talking about. And from there, it will impinge, infiltrate, and then gradually get itself into the blood system and then get spread, what we call metastasis or distant metastasis, to other part of the body. And that is stage 4 of the disease.
I just read, incidentally, just I think it was last night, that the World Health Organization released, this new statistics, which, it estimates that 37% of all new cancer cases in 2022, were linked to preventable causes, including high among them tobacco, alcohol, body mass, high body mass, and inactivity, as well as air pollution.
Yeah.
Can you speak to some of this? Because these are things that are all around us.
So generally, there are so many causes of cancer. Cancer, that is in layman terms, but when you meet a professional, generally he will tell you that the exact cause of most of the cancers that we are seeing in the country, the causes are not known. We don't know what actually causes in most of the cases. However, we have some peculiarities, like in the case of cervical cancer, we can categorically say 90% or above of the patient is a virus that causes human papillomavirus, and that is based on the researches that has been conducted nationwide. So the etiology is quite big, depending on the environment that one lives. But generally, we have some compound or certain behavior that are linked to causing this cancer. And that is what the scientists call the risk factors. Yeah, so these are factors, the things, or the habit that if an individual is continuously indulged in, he becomes more predisposed than somebody or an individual who doesn't do that. Like tobacco smoking. Tobacco smoking, virtually, it has been linked to so many cancers, right from the lips, the tongue, the throat, down to the anal. Virtually most of the lung cancers and what have you. We also have intake of alcohol. Some in the West are saying that, please, if you can just limit your intake to just a cup, per day. But the ideal thing they will tell you, if you can stop it, is the best for you. Yeah. So, and we have taken fatty food, a lot of fatty foods, fatty foods, and then taking preservatives, virtually the canned foods that we have on the shelf, and bodily inactivity, lack of the exercise. It is expected that one should exercise his body at least, for 30 minutes on daily basis. That has been linked to reduction,
Okay,
the incidence of cancer.
Yes, I think we need Dr. Ikide. I'm just wondering. She said hers was caused by excessive production of estrogen.
Yeah.
Yes, and I'm just. Could you break that for us? And then, how does alcohol? Because a lot of people will be wondering, alcohol, and inactivity. How does that relate to cancer? How does it trigger cancer?
Okay, thank you so much for having me. To start with, there are different types of breast cancer, and when we want to break breast cancer down, we talk about the histological types. To start with, there are different histological types. We have the invasive ductal carcinoma, the lobular carcinoma, and so on.
Please, can you take them slowly so that yes.
If I break that down now, we will not.
No, just slowly when you mention them. Yes.
Okay, invasive ductal carcinoma. That has to do with the duct of the breast. Then lobular carcinoma, that's a different type. There are other histological types. Then going deeper into it, we have the immunohistochemistry. That is another test we do to know which ones are hormone receptor positive or hormone receptor negative. So the hormone receptor has to do with the estrogen receptor, progesterone receptor. So it can be positive, it can be negative. Then the third line is the human epidermal growth factor receptor. It can be positive or negative. So for hers, you said it's positive.
Yes,
but then the hormone receptor is negative.
Yes.
So that means she's ER/PR negative, HER2 positive. So there is a targeted treatment for that, and which I must say she got the right doctor that knows what he or she was doing. Also, when people present like this, we like to look into it. What did she do right? What did she do wrong? So we can use that to educate other people. If I'm to punch into what she said, for you to pick a mass that big, it simply means screening was not there.
So because if screening was there, we would have picked it earlier. But didn't screen, but we picked it. Okay, now what did she do right? She got a very good doctor who happens to, tie your clinical examination with the histological report. Because when it came out negative, any other doctor that is non-oncologist will have just believed that. But when you tie the history with what you're getting from the histological report, you know that does not go well. So he requested for a repeat, which saved her life, which I must say, I think you should go back to that doctor and give him another big thank you. So that aside, when I listened to her again, she dived into diet, right? But we have to be careful when we talk about diet in Nigeria. Nigeria is not America, it's not Europe. If I ask you what you ate last night, it might not be balanced. If I ask you what you ate, it might not be balanced. So people are fighting against living. So we cannot really go by what we see online as food. If you ask me when last I took blueberries, I can't remember. So she made mention of soursop. I live in South Nigeria, and there's something going on. And thank God the DG is here. There's something going on. When people come down with cancer, there's what they call soursop therapy, pineapple therapy, and they wouldn't come for treatment. It is sad. And they will only present when it's already stage 4 and you can barely do nothing. And when you ask,
so they now depend on this therapy?
Yes. It is a menace in South. I don't know if it's ongoing in other parts of the country, but I know the South, Asaba, Warri, they do soursop therapy, they do pineapple therapy. That's why I said, when they hear this, they like to hold on to that. Oh, somebody with stage 4, she took soursop, and they sing it. But what she did...
And they forgot the medical aspect.
No, what she did was balanced diet. That was what she did. In UBTH, we tell our patients, go for balanced diet.
No, she became a vegetarian.
It was balanced. She balanced everything.
But it's balanced. It's not just a shower shop.
Yes.
It's not just the pineapples. It's balanced.
It's balanced.
Unless your body can't take it.
Yes.
Right?
So that's what I want to go. You understand? It's balanced. She went for. What they even say is for each meal, take one fruit. To make it balanced. So I think people should get that right.
Yeah.
Go for balanced diet. You understand? Soursop is good, pineapple is good, everything is good, but balance it. That's the main thing. That is what I want to pick up from this.
Thank you. Sorry, just continue taking your medicine.
Yes, continue taking your medicine.
Continue taking
and
your
see
medicine.
Your doctor.
I never stopped, and that's what saved me.
Yes. And one last thing, please. Please, when you find a mass, please, whichever doctor you meet, please make sure you see an oncologist. There are 5 oncologists in the entire South. Whoever you see, make sure you request to see an oncologist. Please. Thank you.
All right. Thank you, Dr. Akile. Thank you very much. Let's now quickly get to our Lagos studio where we have Dr. Molola Salako. I just want to ask about treatment. We've heard Chioma's story. I mean, I have the experience of my mom, yet I have known many more people who didn't make it. Is cancer still a death sentence in Nigeria?
As well as your mom's story, and I hope everyone listening, whether they're on active treatment, they will continue to stay on treatment and be inspired that treatment does work and that cancer is not the death sentence. Just to clarify, I've worked with several great institutions, but currently I work at Pearl Oncology Specialist Hospital. With respect to treatment, there are several types of treatment. My colleagues have done a great job in highlighting surgery, chemotherapy, hormone therapy, targeted therapy. Targeted therapy is when we look for something in the cancer to target. It may be a protein, it may be a hormone. Like Chioma said, there was a protein that was HER2 positive. If we target that protein, if we damage that protein, it means we stop we stop what is feeding the cancer. For some people, it will be the estrogen, which is a hormone present in every human being's body, but it is more in females. So for cancers like prostate, cancers of the womb, they are driven by hormones sometimes. And then we have immunotherapy, and this is when we give drugs, medications that actually trigger the immune system to wake up, jump up, and do their natural work. Cancer is not a death sentence, especially if we take advantage of the low-hanging fruit. The reason why many people continue to die of cancer in Nigeria today starts with the fact that we are not even preventing the cancers that are preventable. So 40% of cancers that occurred last year, 2 years ago, should not even have started. Cervical cancers should not affect any woman. But even though the government has rolled out a robust vaccination program, there's still this, I don't want my daughter to get vaccinated because they say it will cause infertility. Now, if we don't prevent cervical cancer through vaccination in 2026 for a girl that is 10 years old, 40, 50 years from now, she would have encountered the virus and then she becomes one of our patients. So this is an appeal that for us to remove the narrative of death sentence, let us prevent the preventable cancers. There's also something about inflammation that we silently don't talk about. Inflammation is the foundation of cancer. It plays a role in causing cancer, and it also progresses cancer. What are the things that make a body inflamed? My colleagues have said most of it, including Chioma, who's my learned colleague. Eating the wrong diet that is not balanced. We all need a healthy dose of carbohydrates, protein, and fruits. Now, our immune system is packed in our intestines. 70% of our immunity is in our intestines, where we have good and bad bacteria. So if your diet is rich in fat, oil, sugar, you are feeding the bad bacteria. If your diet is rich in red meat, like kilishi, orishirishi, suya, asum, those of us that like it in heavy quantity, the body has a way of processing excess red meat to a chemical called carnitine, which converts it to another type of chemical that begins to irritate the intestine and then causes inflammation, and that can trigger cancer. The other thing about inflammation is it also occurs when there's chronic infection. Today, we see liver cancers jumping from 10th common cancer to like the 7th common cancer. What has happened? Hepatitis B and C is very, very common. Nigeria is hyper-endemic zone for hepatitis B and C. And many people are carrying it without symptoms, are also not treating it. Give these viruses 20 to 30 years. They convert the liver cells to abnormal cancer cells, and such people present to us, the oncologist, for treatment. So it's important that we also focus on preventing the preventable cancers. Now, there are the remaining 60% of cancers that science has not found a way of preventing, like breast cancer, some prostate cancers. It is important that we go for our annual medical checkup. It's as simple as that. Because when we talk about cancer, we have the knowledge to prevent cancers, detect it early, and treat it effectively. But also, some cancers are kind enough, and I repeat that, kind, K-I-N-D, enough, to show us some little signs that, hey, I'm going to become cancer. If you leave me alone for the next 20, 30 years, I will blow up and become full-blown cancer. But we are not picking that because people are not presenting for their screening or for their medical checkup. Or unfortunately, they do present to the hospitals, and then the medical system makes an error or doesn't pick that up. So cancer is not a death sentence if we put the right pegs in the right holes.
Dr. Salako, thank you very much. I'd like to make that short trip from Lagos to Ibadan, where we have Dr. Jimo. We thank you very much for your patience. And nuclear medicine comes to me as something new. What exactly is it, and what's its role or its place in cancer care?
Good morning, everyone. Thank you for having me. The nuclear medicine is also a specialty that also involved in the management of cancer. And we have few centers in Nigeria. And then the main purpose, the main function of nuclear medicine is to make a diagnosis and therapy. So they use radiation, like clinical oncology or radiation oncologists use radiation to treat cancer. In nuclear medicine, they use radiation to make a diagnosis, also make a treatment. For example, thyroid cancer, prostate cancer, breast cancer. The common one that people know nuclear medicine for is the use of bone scan, but it has gone beyond that level, where they use the nuclear medicine facility to do some investigations or diagnosis or even therapy. For example, prostate-specific membrane antigen can also be done in nuclear medicine. And now, recently, Ibadan has started treating prostate cancer, especially the aggressive one, with high body disease with lutetium treatment, which is not common and is first of its kind that started. So the management of cancer involves multidisciplinary, where we have different specialties, including the nuclear medicine. Why it's not that common is because we have few centers in the country, but it's also very useful in the management of cancer in terms of maybe diagnosis or even therapy.
All right, thank you, Dr. Alani. We'll come back to you. Let's again return to Chioma once more before we begin to look at what is available, because you've given so much thumbs up for Nigeria, and indeed we know that recently the Ministry of Health, has done quite a lot in terms of establishing oncology centers across Nigeria, and I think we have about 6 oncology centers, established by this administration. But first of all, after your diagnosis, were you adequately informed about the journey you were about to go into? And were there times or moments that you felt either emotionally or financially overwhelmed or drained?
Well, I think there were 2 things that happened to me. So when I got diagnosed, they said that I had to remove the lump, which I did, right? Then the doctor said to me, but that's just the beginning of the journey. I had no concept of the ecosystem of cancer. So I just thought, okay, we'll take out the lump, and then maybe I may have to do chemotherapy, maybe I have to do radiation. But back then, which was in 2015, the chemotherapy that I needed to get, it wasn't available at that time. So being a Canadian citizen, I called my Canadian doctor and she said, run. You have cancer? Run. So I came to Canada and I had to wait a month to get into the cancer system. If I didn't remove the lump in Nigeria, I don't think I would be here today. So I continue to say how Nigeria saved my life. Now, when I was in Canada, they staged me stage 4 because the cancer was in my liver, it was in my kidney. The tumor was in my chest wall. It was in my lungs and my bone. In fact, they gave me a death sentence. The doctor told me in Canada, go and put your affairs in order.
That's you. That's you on the screen. That's you.
Yes, that's me. That's me. That's me. So very scary. They gave me a death sentence, and I told them, and I said, look, give me the cocktail. Let's start with the cocktail.
At what stage was this?
This was, I had just finished my last 9 cycle. My head was bald. I lost all my hair. I had just finished my 9th cycle, that picture. And that was, I went to celebrate that, oh my God, I survived chemotherapy. And so I was very well informed. The last, when I was sitting down with my doctor, he said to me, Choma, you can now travel back to Nigeria. And I said, oh, thank God. But he said, I will advise that you don't go because you have to take your 21-day medicine. And I don't know if they have it in Nigeria. So we called the medicine, the pharmaceutical company, and it was in Lagos. Oh. And they took an undertaking. It's Roche Pharmaceutical. They took an undertaking and said, absolutely, we will avail it. And luckily for me, in 2017, the government had the Cancer Health Fund, which when I came, I signed in, and it was available because I said, oh my God, how am I going to afford this? So I was here at the right time. So when I came back to Nigeria, National Hospital made the drugs available. And they really had an oncology center. My doctor became Dr. Shagaya, and she's brilliant. She looked after me. So there were things that I did right. I listened to her. She said, Choma, and even my doctors, they did not want me to come because they said, Choma, you have such a great story. Why do you want to come back to Nigeria? I said, because it's my home. And part of, as an oncologist, you've taken an oath. It's not just about surviving cancer. It's about living my life normal every day. And I chose...
Did you come home because you had absolute faith in the medical system?
Absolutely.
Or because of some other...
Absolutely. I didn't even think twice about it. Maybe naively. I wanted to come home. And people thought I was crazy. So I was very intentional. And then I got stuck in COVID-19. How did I survive cancer in COVID-19? I couldn't leave. So I had to get a special pass to go to National Hospital. And you see, I mean, we are brilliant. I mean, everybody says a lot of things about Nigeria, but when we have to do the right thing, we're exceptional. And everybody in my cancer journey made sure that I got those drugs, even during COVID-19.
You talked about the cancer fund, health fund.
Yes.
And I know that NICROT has a role to play in this because
yes,
NICROT and the fund were supposed to provide some form of support to indigent patients. What's NICROT doing about that? Because a lot of people who don't survive actually are not Choma's, in Choma's position. Most of them are in the rural area. Most of them are in Agbaji, in Ilorin, Kakbumu, in Mbise, in Kitipupa, in those rural areas where the centers are not available.
Yeah. So thank you very much for that. And I have to thank Chioma for actually bringing this up and then giving credit, to the government for actually doing the right thing as against what we've been hearing, nowadays, condemnation, everywhere. So as Claire said, the National Cancer Health Fund, is actually a system of that has been set up by actually the federal government to support the indigent cancer patients, within the country. We've started with a pilot where we selected cancer centers of excellence within the country, within the 6 regions, the geopolitical zones of the country. We selected 1 teaching hospitals, oncology centers of excellence, where they offer virtually all the complement of all the cancer treatment services. That was, it's just a pilot to test run how it will work, and we have good testimony.
Amazing.
Now, what NICRA did, that is the National Institute for Cancer Research and Treatment, is to go ahead, and then expand the program based on the directive of the Honorable Coordinating Minister and the State Minister, for health and social welfare. They gave us a marching order to expand the program. So what we are currently doing is to identify some general hospitals, within the states that offer some form of cancer services to serve as what we call the sub-hub. So the oncology centers, the cancer centers of excellence that we have are the hubs. Then the general hospitals that offer some form of chemotherapy or surgery, some cancer care, are the sub-hubs. And then we also pick some active primary health care centers within the country that do some form of screening, health talks, and whatever, to serve as actually a referral link to this general hospital. So what we did was, considering that virtually a large percentage of Nigerians are living in in virtually the rural areas and the suburb. So what we did is to establish this referral linkage from some active primary health care services to the general centers that offer this care, and then to the cancer centers of excellence. But we've completed this phase because it's the second phase. What we are currently doing is to work with the philanthropists in the country and some other well-meaning Nigerians to actually support individuals, because whatever you do, you have limited funds. And the funds are purely or merely meant for the indigent cancer patient. But anybody that has cancer and hears that the government is giving free treatment, you will want to access it. So we have to put check and balances so that the people that the money is meant for actually reach those indigent patients that is in the country. We are still working to actually get more funds so that more people can be enrolled. It's currently ongoing, but then not to the level that a lot of Nigerians are expecting, but it's still working, and we'll still continue to solicit for more funding.
But are patients aware? Sorry, Victor, I know you want to come in. Are patients aware that they can access, the support from? Yes.
So awareness virtually has actually been ongoing, and sometimes maybe I have to share on our website. If you go to NICRAT, the website of Cancer Health Fund, I refuse to allow anybody to put this number. I put my own number there, so that as the DG, if you logged in, and definitely it's my number that you see. And even yesterday I had conversation with some patient that how can you help me? I have my mom with breast cancer patient. I asked this guy, where are you? He said, they reside in Gwagwalada, but they have exhausted. I said, okay, is that where your doctor is? I said, okay, so ask your doctor to please refer you to the hub, which is the National Hospital, and enroll you on the platform. And he was grateful. So, and he was saying that I never thought my destiny will be responded to. So that is actually currently what we are doing, and will continue to do. We have to commend the federal government for doing that.
If you don't mind, you need to give us your number again, right, so that yes, please, Victor, go ahead.
All right. Dr. Hille, what warning signs would you say Nigerians do often ignore, which could play a big part in overcoming cancer?
Okay, as they always say, early detection saves lives. So most of the time, people, when they see, for example, when they see a lump, even as small as, because usually in women, is the husband that probably picks it first. So when they see this, and the first thing that comes to their mind is, God forbid, and they go to church, they go to mosque and pray. But I'm saying this not to play down the pastors and the imams. I'm a Christian. Yes, but when the religious leaders have issues, they present early. But when members have issues, they go to religious leaders. Or mosque. They go to religious leaders and they delay them. They keep praying for them, take them to mountains. But if they are presented early, there are drugs, there's treatment available in the country right now. So if that is solved, I think we can move forward, because early detection, as we all know, saves lives.
All right, thank you, Dr. Hile. Let's get again to Dr. Molola Salako in our Lagos studio. And I'd like to ask, what exactly would you say limits access to radiotherapy, for instance, in cancer care?
It will be the usual 3 barriers. We call them the 3 A's. Is it available?
Use your phone.
We have about 11 radiotherapy machines in the country. The government is currently expanding. New centers were launched last year, even early this year, and more centers are going to be rolled out in a way that patients don't have to travel from south-south to southwest or from the north to the east for radiotherapy. So non-availability of certain radiotherapy equipment and specialists is a major barrier. Then accessibility, ability to just travel, it will still take 2 to 3 hours for people to access treatment. And then affordability. In public hospitals, radiotherapy may cost anywhere between 500,000 naira to 1 million naira. In some public-private hospitals and private institutions, it ranges from 1 million to 2-point-something million naira, for which many patients can't afford. And whilst the CHF, the Cancer Health Fund, is supporting many patients also still don't have access to it. So the government is doing a great job. Philanthropists are doing a great job, but the demand outweighs the resources. And we have to expedite action on that, because some of these cancers are preventable. Thank you.
I wanted to ask again, I want to stay with you, because apart from the limits to access to care, which we are talking about now, and which still is a very important factor, would you say that medicine or cancer treatment, cancer care has advanced enough in Nigeria? Access is one thing, but has it advanced enough? So far, we don't know what causes most of the cancers, but has it advanced enough to take care of the magnitude, the quantum that we have and have come to know in Nigeria?
One thing is for sure, yes, cancer care in Nigeria is better. It's advancing. We're receiving patients from all over Africa. We have patients who go to diaspora and come back to Nigeria to continue their care. They left because they didn't trust the healthcare system, but they eventually come back because they know and they are pointed to the right places. We do have the beautiful framework of what every country should have when it comes to taking care of cancer patients. We have it well laid out, well planned. It's a matter of expanding what we have. For example, we have 100 clinical radiation oncologists in the country. On this call, there are 4 of us present out of the 100. For us to advance cancer care, we need to 5x that. We need 500 more radiation oncologists. And that means we are deliberate about talking to our medical students, mentoring them, and pushing them into the path. That is one important way we have to advance advanced cancer care, basically. And it's not just about the radiation oncologist, it's the pathologist, it's the surgical oncologist. So we really need to expedite action on our personnel. Then we actually have to make cancer care covered, because most patients, this drug Chioma talked about, as wonderful and amazing as it is, it costs about 30 million naira. Most patients can't afford that. Most health insurers that cover cancer care put it at a cap of 3 million naira, 4 million. So the patient will still go and find another 20-something million. So there's progress. There is progress. but we have many problems, and the solution is within our country. With the DG and the Federal Ministry of Health and the support of the private sector, we can tackle cancer and bring down the burden. First, by preventing cancer, improving our personnel, and just speaking the narrative. We have many success stories about the advancement in cancer care in Nigeria, but the good news is not being sold as much. And I think what dampens it is the fact that many people now present to our hospitals late with stage 4. They are 1 month to dying from the disease. The equipment is no more useful. The specialist is no more useful. I am frustrated treating cervical cancer patients because, for example, I treated someone recently. She was flown into Lagos in an ambulance on oxygen. We had to diagnose her and we had to return her back. And they had spent millions of naira, more than 50 million naira to fly her in, fly her out, and all of that. But if this woman had been vaccinated or had done a pap smear that is 30,000 naira and done the colposcopy, which would have cost 150,000 naira, why would the cancer even develop? So sometimes we really need to sit again and focus on the grassroots information, make sure every PHC is providing the screening services, the basic, let's get that right. The advanced centers, let our patients present to us so that we can treat the cancers that are not preventable and let the PHCs prevent the cancers that should not occur.
Dr. Salako, thank you. Thank you very much for the points that you have raised. Let me bring in Dr. Alani into the conversation now. And please remember, you can also send us your messages. The number to the number you can send your SMS is right there on the screen. We would also display the NICRAT Head Fund, which of course you can also access on the screen very soon. But Dr. Alani, I'm just wondering, with all the good things that everyone here had said about what is happening in Nigeria, efforts towards preventing and treating cancer, we still have very low survival rate, 25.6%, surviving not beyond 5 years. That's if that data is absolutely correct. That's quite low, and I'm wondering what could be this factor beyond late presentation. Could patients also be understaged or inadequately staged even before they begin their treatment?
We need to educate our people. We need to create awareness. Part of the education and awareness is what we are doing now. And people need to listen so that they said some cancer can be prevented. And the one that cannot be prevented, early diagnosis is the key. So that we don't have mortality, high mortality. So we need to continue create awareness, educate our people, and also promote, encourage people to go for screening, even vaccinations, early diagnosis, prompt treatment. So education and awareness, because ignorance, learned people can also present late. And this is an ignorance. They know, and they don't come to the hospital in time. People need to come to the hospital in time. The one that can be prevented, why not, promoting those areas? So we need to continue making noise to tell our people that once you notice something in your body that is abnormal, you need to present to the hospital to see a specialist in that area so that at least it will not progress. And with the one that we cannot prevent, we know early diagnosis, like we are saying, is the key to cure the disease. But if patient now comes stage 3 and 4, it's really difficult at times. We have exceptions, like Chioma's case, that doesn't follow exactly what does book says about stage 4. They will tell you stage 4, 2 years to live. But we have seen exceptions now. We also manage quite a number of patients that also present at stage 4 and they're still alive over 10 years. But the percentage of those categories are very small. So we need to continue to encourage our people to also participate or listen to health, care talk whenever it's happening, or when they are doing the awareness. People need to listen. People need to participate. So we need to also support even people that are involved. We need to support them. Thank you.
All right, Dr. Adlani, thank you. I actually wanted you to speak to the staging of patients because, like you said, Chioma is an exceptional case. Usually, they say stage 4 is the most complex to treat, and patients rarely survive that stage. So I'm just wondering if we do have 25%, 0.6% of survival rate, which is very low, could there be under staging or mis-staging? I don't know.
Thank you very much. In cancer, for example, now, let me use cervical cancer as an example. We have stage 0, which is CIN 1 to 3. We have stage 1, we have stage 2, 3, and 4. Right. When patient present with stage 0 or stage 1 and 2A, which fall into the categories of early case, it is sure that it can be cured. But by the time patients present at stage 2B to 4B, you can manage the case, but it may be difficult to cure. And most of the cases that we see in our environment fall into the category of stage 3 and 4. You can pick stage 0 during screening, if people go for screening. So early cases from 0 to 2A, for example, in cervical cancer, then 2B to 4B, they are difficult to cure, but they can be managed. So early cases are usually curable, while the late cases will be struggling. Not that we cannot cure some, but the percentage of the one that can be cured may be very small, like we are saying in the case of the Chioma now, that breast cancer, we also have stage 1 to 4 in breast cancer. The stage 1 and 2 are easy to cure, while stage 3 and 4, you can manage, but it's difficult to cure. So, and that's what you see across the nation. Most of the patients, despite the awareness, despite the education, our patients still present late. People will first of all go to a religious house first before they present to the hospital. And that's why we are making noise that people should come to the hospital first. Not that they cannot go to a religious house to pray. You can pray, and then along the side, you can also do your medical treatment. So early cases are easy to cure. Late cases, you find it very difficult, but you can manage. Thank you.
Yes, Chioma, you want to say something?
What he says as a cancer patient. So my doctor said to me, had you been stage 1 or 2, you would have only done 4 cycles, and you would have only had to do it for 18 months, and that would have been done. It would have been cheaper, it would have been cost effective, and I wouldn't have had to do as many cycles. But because I waited and I didn't do anything, and it got to stage 4, I have to be on my drugs for life. In fact, the new thing is that if in 20 years, in another 10 years, I can stop taking Herceptin and Projecta. That was the new Roche clinical trial that they've done. So in another 10 years, I'm done because of stage 4. Now, that's why they keep talking about stage 0, stage 1, stage 2. It is cheaper, and you live.
What stage was your mother, Victor?
I remember my mom was saying then that the doctor kept begging her to come for treatment.
I'm telling
you. She presented early, and the doctor kept saying, come, please come for treatment, and they had to raise the money and all of those at the time. I think that helped a great deal.
Huge.
That helped a great deal because it was dealt with once and for all.
If I may comment, I think the big issue here is when someone is diagnosed, probably outside the tertiary institutions, that person should be referred to an oncologist. What is a non-oncologist doing treating cancer alone? That is the problem we have in most parts of the country. They keep these patients, they start treating them, then when they can no longer manage them, they refer them to teaching hospitals where they are all hospitals where they have oncologists. So if someone is diagnosed cancer, it's either you call in the oncologist to co-manage with you,
What are specifically the duties of an oncologist?
An oncologist, we have different different types of oncologists. We have the radiation and clinical oncologist. We have the surgical oncologist, pathologist, oncology pathologist. So the surgical oncologists are the ones that do surgeries as regards to cancer. The radiation and clinical oncologists, they actually manage the chemotherapy part and give radiation. So when let's say a GP practitioner sees a cancer patient, what are you doing? Keeping this patient. Refer this patient, and in fact, the patient should ask, is either you bring in an oncologist to see me and give you to see review and send to the teaching hospital, you refer immediately. So that's the big problem here.
Isn't that mandatory?
These patients and refer them late when they can no longer manage these patients. So I think that needs to be. I think that
has to be settled in the with the medical professionals. But let's take some questions before we go on break. This one reads: Good morning to you, Claire and Victor, and the guests. I am Ademola Adeoye from Lagos. Ademola could have been here himself, and he says, my questions are: one, to Chioma. Could you tell us how you coped with the emotional and psychological impact of cancer and the role your family, friends, and groups play in your journey? That's one. Two, to the doctors. How can Nigerians access cancer treatment and support services? I guess that's been answered a bit. And three, what are the most important messages you would like to share with cancer patients and survivors? And I have a second message from Nandom Wiep in Jos. He said, how long does it take for cervical cancer to develop? Are genital warts cancerous, as they are also caused by different HPV strains? Does the location of these warts, e.g. genital, anal, oral, increase the risk of cancer? Is the HPV vaccine still beneficial for someone who already has warts? Thank you for your service. Have a good morning, he says. I don't know if we have time to respond to the questions, but okay.
I think we'll take a break.
Take a break and return to the questions. Please stay with us. Good morning, Nigeria.
All right, thank you for staying with us. You're watching Good Morning Nigeria, and we have received your messages. Victor, of course, finished reading his, and I'm sure he had some more. He had some more. I also have some more, and I'm sure you've also seen the NICRAT number on the screen. Victor, take your final three before I take mine.
Let me quickly take this. This one reads, good morning. Please, I would like to know at what stage hepatitis B becomes cancerous and at what stage treatment can start. Says thank you, no name. This other one, my name is Habiba from Yola. I want to know if cancer screening is free. Short, simple, and finally from me here.
Great.
Good morning to you all. I'm a brain tumor patient and people hardly talk about it and the way out. Please, can any of the doctors speak to the treatment available in Nigeria? I guess that will be for another day. Perhaps we would have to schedule that.
Let's start with the screening.
Okay. So I think a very good question. Now, screening, as you know, is actually what helps most of our cases to present early. Now, the government is currently doing much in that aspect because currently, I think today, being the World Cancer Day, the Honorable Minister of Health is going to launch an initiative by the Renew Hope agenda of Mr. President Ahmed Bola Tinubu, what we call a NICE scan. We call it a NICE scan because it is an initiative of the federal government through the Federal Ministry of Health and NICRAT specifically to establish cancer screening centers in 6 geopolitical zones. And today, as World Cancer Day, the Honorable Minister is going to launch the one in the North Central area, North Central Zone, which is situated, at Jabi, Federal Medical Center, Jabi. The screening center is well equipped with mammography machine, scanners, and even kits, different type of kits, and you always have a doctor that can interact with you. If you want to get yourself screened, he will guide and advise you on what to do.
And it's free?
Is free for now. We just want to make it free for like 3 months now, and then subsequently a token, and it is a gift by actually the federal government to help patient to present early, and once they present early, the chances of cure is
and for cervical cancer, HPV vaccine, for instance, how accessible?
So HPV vaccine is currently accessible to virtually because it has been, inculcated into it has been part of the national immunization program. So if you can just walk to any primary healthcare centers or general hospital governmental agencies and say that you want to get that, you can. Have access.
Okay, so
please,
yes.
I would like Choma to respond to Ademola's questions.
Okay.
The emotional.
Because he asked, specifically directed it to you, how you coped with the emotional and psychological impact of cancer and the role your family, friends, and groups played in your journey.
I think cancer survivors are unique. Mine was different because, first of all, I wanted to do this on my own. I took it as a journey, so I told my family that I needed to focus. So they didn't play a lot of part because I really wanted to focus. I know it was very. There was no distraction. I prayed a lot. I just wanted to focus and be laser focused on my journey. So that was different. Most people have family around. I chose a different route. I actually think that the journey of cancer survival is harder than finding out that you have cancer. It's tough emotionally. The first 2 years I went through, oh my God, I think I have a lump. I would run to the hospital. Oh my goodness, oh thank God. Oh, I think I feel something here. So it's up and down the first few years, and then it becomes a little bit normalized. So it's tough. It's not easy. It's much easier now. I'm actually enjoying the process because I've cheated death.
Sorry, can I just throw
okay, just yes.
At UBTH, we have UBTH Psycho-Oncology group, where every other Thursdays, all the doctors, nurses sit down with all the patients, and we let them express themselves. So that's how we help people through this journey. And also we created a WhatsApp group for all the doctors, nurses, and all the patients. So because we realize it's not just to receive this treatment. What of after treatment?
Yeah.
What happens when they go afar?
Yeah.
Let's assume they receive treatment in Benin and they live in Ughelli. So how do they access care? That matters a lot. That helps them. So at times some will call and just be crying on the phone. So, but maybe a resident will have to pick the call and talk to them, help them through that. But now, NICRAT is coming up with something. Thank God the DG is here. That is telemedicine. So, which they're establishing in 6 geopolitical zones, I believe, which, thank you so much, UBTH is one of the beneficiaries. So, which with that, we can actually interface with the patient and maybe doctors close by in case things like this happen, and we can tell them what they can do. And with this, we are more or less educating those other doctors on how to manage these patients. So I believe that can go a long way in helping patients emotionally, psychologically, and all that. Thank you.
All right, let me quickly take my own messages. I just start with Bello Mohammed, and he says, good morning. Please, what is the relationship of cancer and testosterone, Abi? Levels, yes, for a prostate cancer patient. Okay, that's from Mohammed, Bello Mohammed. This one is, good morning, panelists. My sister is billed for ovarian and cervical cancer operation tomorrow at NARH in Kaduna.
Okay.
As rightly observed, she came from the rural area and was diagnosed last week. So he says they've already handled the various tests and surgery costs. So can the DG assist in enrolling for the chemotherapy, please? I think the number, yes, please, can you take that?
Yeah, so I think it's a good thing. I will advise her to go to the hub, that is the ABU Teaching Hospital. It's actually the hospital, the center, Shika, that is representing the Northwest. So she should go there, the oncologist, and tell them that this is what she wants. The oncologist will automatically enroll her if she fulfill virtually all the
so
requirements.
She should go to ABU?
Yes.
Zaria?
Yeah, yes. It's the center that is serving the Northwestern.
Okay. Funny enough, you didn't even include your name, so I don't know how to relate to you, but I'm sure you must have heard the DG says go to ABU Zaria. And the next one is from Omololu BA. Omololu says, good morning, Nigeria. Good morning to you. God bless you for good jobs done every time. Talking about cancer, I'd appreciate if the experts in the House can place more emphasis on preventive measures rather than cure. Please tell us lifestyles and or intakes that could facilitate development of cancerous cells. Secondly, please tell us more about those types of cancer that are not preventive, because I still believe all cancers are preventable. Thank you. Omololu B.A. From Ayuba Didan from Gombe State. Cancer is a major challenge in Nigeria. You say you lost your brother some years back. You want to know what government is doing in terms of treatment, because most victims don't make it. And it seems diagnostic facilities in hospitals are scarce. In your brother's case, you say they had to arrange for drugs from South Africa, which took 3 weeks, within which period your brother unfortunately passed on. Ibrahim Biu, this is from you. Good morning. What are the common cancer treatment procedures in Nigeria, and what are the early symptoms of cancer? This is from Lagos. I just wanted to clarify, can fasting as in Ramadan fasting or Easter fasting or Lenten fasting help in treating cancer? I've read that some proponents say fasting can help treat and even cure stage 4 cancer. How true is this? Okay,
Yeah,
so let us bring in Dr. Mololu. Dr. Mololu, are you there? Dr. Mololu, did you hear? Can fasting, as in Ramadan fast, Lent, sorry, Dr. Salako, I beg your pardon. Can it help to treat cancer?
So there are two types of fasting. There's the religious fasting that you've alluded to, like the Lenten and the Ramadan fasting. That's religious. But there's also the medical inclined type of fasting, and that's when you eat for certain hours and don't eat for for a long period of time. So the idea is, for example, if you're fasting from 9 a.m., you can eat till maybe 7 p.m. That's about 10 hours. And then for the rest 14 hours, you are not eating anything except drinking water. Some people do the other type of aggressive fasting where they wouldn't eat anything for a whole day or a whole month, and they'll be drinking water. And it is controversial, but there is some science that promotes fasting, because the body is actually built to not eat carelessly. And so it has to be done with caution and with the support of a registered dietitian and an oncologist. These days, we see some patients fasting carelessly and they get malnourished because they are not having a balanced diet. So there is a role for fasting, but it has to be done safely. I recommend such people talk to a registered dietitian experienced in taking care of cancer patients.
Thank you.
Thank you.
Yes.
Prevention. the fasting can serve maybe as a good mode of preventing cancer. But treatment, no. Please eat well. If you already have cancer, what are you treating?
That's another question. I said, what is government doing in terms of treatment? That's Ayuba, whose brother, passed on.
Okay.
Sir?
I think that's been answered.
It has been answered. We have, in fact, you've also mentioned it. So the government currently is doing a lot in assisting, the cancer patient in the country. We've mentioned the provision of cancer screening centers in the 6 geopolitical zone. The minister just a few months back launched 6 new centers, of excellence with brand new radiotherapy equipment. The National Institute for Cancer Research and Treatment, through the ministry and under the Renewed Hope initiative, is changing the source and bringing the new brachytherapy equipment to these 6 centers of excellence for cervical cancer treatment. The HPV vaccine that is ongoing is for prevention, so that is also from the government. So the government is doing it a lot, and it will continue to do a lot, in this area. And I think above all is the establishment of an agency by the government to pay for cancer control generally in the country, which is NICRA. It has never happened before in the country, and it's happening in the country for, I think, for the first time. So we have to commend the government of His Excellency.
In terms of funding, I think you should emphasize.
So the funding, we also have Cancer Health Fund, which we have just mentioned, meant for indigent cancer patients to support their treatment. And there is also what we call a catastrophic health fund, which the government of His Excellency Ahmed Bola Tinubu, through the Federal Ministry of Health, has now established under the National Health Insurance Agency to further assist and simplify the treatment of cancer, improve access to virtually Nigerians. So a lot has been actually
all right, thank you very much, Prof. Let's quickly get to Ibadan as we wind down this conversation. And I'm asking Dr. Alani, what you suggest should be invested in first in overcoming cancer? Should it be equipment or the people?
Very much. Well, the personnel and the equipment both are very, very important, because if we have personnel without equipment, it is not balanced. And if you also have equipment without personnel, it's also not workable. So the two must go pari passu, that we have the personnel, the specialist training, and they also have infrastructure with equipment. For example, now we have the equipment, radiotherapy machine in Nigeria are not enough. Government are doing their best, and even the private facilities are also joining government in doing their best to make sure we have enough to cater for the country. So we must go with the two, both the personnel and the equipment in form of infrastructure, so that we can have a balance and be able to cater for the population of the country.
Okay,
thank you.
Dr. Jimoh Mutiu Alani, we'd like to thank you very much for joining us for this conversation. Dr. Alani is a radiation clinical oncologist, head of department, nuclear medicine, University College Hospital, Ibadan, and he joined us from our Ibadan studio. Thank you very much. Let me also appreciate Dr. Omolola Salako, who is consultant, radiation and clinical oncologist, Lagos University Teaching Hospital, and she joined us via Zoom. Dr. Salako, thank you. We do appreciate you. Thank you. All right, let's also appreciate here in the studio Professor Usman Malame Aliyu, DGCEO, National Institute for Cancer Research and Treatment. Thank you very much. Dr. Emmanuel Hile, consultant, radiation and clinical oncologist and head of department. Thank you very much for joining us. Choma Ikejani, power woman, thank you.
Thank you for having me.
That's Good Morning Nigeria for today. We thank you for joining us. I'll see you tomorrow. I am Claire Adelabu Abdurazak.